Okay. Now, the everyday lives of people, it's been disrupted for what now, 7 months? And let's say we're still wearing masks and social distancing and not fully integrating ourselves into the public for another 7, 8 months. Does this have a lasting impact? Does this year plus period, will that have an impact 10 years from now that we're still going to be kind of reverberating?
That's a very interesting question that I'm not sure I have a definitive answer to. It's. I think there's several things to. First of all, we have no idea how long this is going to last. That really is a big uncertainty right now, and we don't really have a clear idea of what it's going to be like when we come out of this, or how much we come out of it, and what the residuals are, just safety wise, behavioral wise. Um, so and then employment wise, there's so many uncertainties in how we address these things going forward. There are some potential benefits that could come out of this as well that may make things easier going forward. Uh, the acceptance of telehealth and telemedicine, for example, is turning out, I think, to be very useful. Um, we're doing it, most of us now, anybody who can is doing it almost exclusively. And a lot of the insurance companies and states and localities have waived their regulations, so it's become, legal and reimbursable even. I don't know how that's going to go forward, if those conditions are going to continue, but a lot of colleagues I talk to would like to be able to continue doing this kind of thing. Um, there's also, I don't know if there was an article in Barron's last weekend about the acceleration of medical biopharma research, and mostly around COVID, but it really is spilling over into other fields as well. Development of new treatments, new therapies, new approaches to mental health issues. I'm involved in some of those already. Better treatments for anxiety and depression and things like that. So we could have some positives coming out of this to help ameliorate some of those things going forward. But I expect a big residual traumatic impact on general population going forward.
Okay. Now, two things that kind of stand out to me in regards to the pandemic. Um, I guess for the last couple generations, most of the tragic regional events have been regional. They've been weather events or, say, an attack. And in those circumstances, the event ends and then there's the cleanup, whereas we're still in a ongoing event. Does that unique nature change how people mentally handle it? And because it's not regional, it's global, does that make it a little easier? Because, you know, it's not a New Jersey issue or a New York issue, it's not a California issue, it's an everybody issue.
Well, those are reasonable questions. I'm not sure. Part of the problem, for instance, is no place to go. People can't leave. They can't escape. They can't travel to a place that's easier or safer. The fact that we all are in the same boat, that can go several ways. Depending on some of it depends on the kind of leadership we have, for the country as well. Times of crisis, people need good leadership to kind of try to bring them together and try to solve problems collectively, rather than seeing everybody, every person in it for themselves, or how do I? So that in some ways there's an opportunity and a huge risks going forward, depending on how we handle it collectively. I see the governor of New Jersey gets on the, he says, well, things are going to get back, but it's not going to be back to the old normal. It's going to go to a new normal. He's sort of optimistic and fairer and more equitable and more inclusive, and that could be good if we have a shared sense of suffering that we then band together to try to deal with.
Okay. Now, what advice would you give for healthcare professionals as we're preparing to deal with a mental health pandemic that's going to become of this?
For mental health professionals, I think a couple of things. I've been actually giving some lectures to groups and things like that. I think One is that they don't need me to tell them to be as responsive as they can to their patients and as available and all that. I mean, that's sort of baked into
Mm.
our training already. But there are novel things coming along that people need to be aware of, new uses for existing treatments. I'm involved now, for instance, with people who are doing virtual reality as an adjunct to therapy, and that might be promising for people. I'm involved with companies that have got maybe rapidly acting anti-anxiety treatments coming along that could be very effective, uh, and might offer enormous promise as a, in place of the kind of standard therapies we have right now. Um, we need subjects for clinical trials. I mean, we're doing studies. These things have to be vetted, have to be tested, and things like that, um, to make people aware of the opportunities for people to participate in those as well. Um, so I think there's reason to be optimistic as well as fearful going forward. I think it's really, and I tend to be more in the optimistic camp, but I hope that's valid.